Good morning, everyone, and welcome. The topic today for our in-service is staffing and patient ratios. Together, we are going to assess the impacts this has on patient safety and a healthy workplace. To effectively understand this contemporary nursing issue, we'll break it down into background, objectives, outline, and conclusion. Healthcare requires the teamwork and dedication of numerous allied health workers to provide adequate and safe care to patients. Primarily, first-line care is provided and reliant on nurses being able to provide, advocate, and emotionally support their patients. A predominant obstacle for optimum nursing care is adequate staffing and nurse-to-patient ratios, as nurses are pressured to complete specific tasks within their shift. Therefore, excessive amounts of work leads to the fundamental therapeutic care being overlooked or reduced due to lack of time. Australian Nursing and Midwifery Federation states that ratios give nurses and midwives more time with their patients, allowing for better and more timely assessment of each patient's condition, safer care, better risk management, and a reduction in staff burnout and stress. A shortage of staff is a key contributor to unsafe levels of nurses being present on wards / caring for patients, as factors such as unexpected sick leave, lack of qualified staff members, and increased patient demands directly affects the amount of staff available to cover patient loads. Inconsistent staffing and patient ratios is a significant issue within nursing, as a lack of staff directly impacts nursing morale, poorly completed documentation, and neglect of fundamental care for patients. Staffing shortages is a substantial issue that results in unsafe nursing practice, which leads to medication errors, discontent among staff, increased nurse-to-patient ratios, and a lack of fundamental care for patients. Globally, around 200,000 patients die from preventable errors in the United States. Up to 5% of hospital deaths and 27,000 annual deaths in Australia are attributed to preventable errors within the healthcare system. The respect and support is essential for maintaining strong leadership within the workplace. As Mumford states, to survive and prosper, organizations must control conflict, position themselves to adjust to change, and choose the best paths to goal attainment. Conceptually, transformational leadership is highly effective in a nursing context, as it motivates followers by appealing to higher ideas and moral values, where the leader has a deep set of internal values and ideas. Notably, transformational leadership encourages followers to work towards sustaining the overall goal as opposed to their personal interests. This is achieved through a highly shared, supportive, and responsible environment. These skills become a key component of the nursing environment, in particular, depending on wards such as emergency or ICU, where patients and their conditions are unpredictable and thus require adaptive staff and conflict control leadership, where every team member is working towards a common goal of maintaining patient safety in emergency situations. In order for this method of leadership to be maintained and achieved, the desired effect of control, safe nursing practice in a dynamic environment is required by enough members to fill the roles needed. If this concept is applied to the healthcare leadership model, as shown on the screen, the cube of effective healthcare and leadership is only maintained if all parts slot together as intended. However, if a level of staffing isn't upheld, stress is applied to the other sectors, like engaging the team or evaluating results, thus leading to gaps to form within the cube, making it unstable and incomplete. Murray states, the largest component of the healthcare workforce, registered nurses, are viewed as inseparable links to patient safety. As a new graduate nurse, it is important to challenge yourself to learn and evolve as a nurse, but also to ensure you work consistently within your scope of practice. Legally, nurses are required to follow policies regarding to patient confidentiality, professional boundaries, and the administration of errors/near misses. The avoidance or falsification of evidence is a chargeable offence and can result in the loss of registration. The Nursing and Midwifery Council state nurses are accountable for establishing professional boundaries with clients that are based on therapeutic plans and goals for the client. Due diligence for a long-term and close professional relationship is essential at all times. Professional boundaries may be blurred, resulting in legal and ethical offences. Ethically pretending you understand or are qualified to work beyond your scope of practice can severely impact your integrity and trustworthiness as a nurse, thus diminishing your reputation amongst future employers, staff members. It is essential that as a new graduate nurse, in particular, we understand the frameworks and policies for professional, legal, ethical, and responsible accountability for care of patients. Prime examples of such are the Code of Conduct, Code of Ethics, and your health district's specific policies regarding to patient care and your role as a nurse. It is our responsibility as new graduate nurses that if we find ourselves in an environment where patient ratios exceed the recommended 1 to 4 consistently to the point where we feel out of depth and not supported by staff, there is a responsibility to raise this concern with your in-charge, unit manager, or new graduate educator to seek guidance and support regarding feeling out of your scope of practice and in an unsafe environment for you and your patients before gaps in care begin to appear and the work environment becomes physically and emotionally unsafe for patients. Murray states, understanding nurses' perceptions will help the professional and nursing leadership to develop strategies that foster transparency in the workplace, support patient safety culture, increase safety outcomes, and improve error reporting systems. Thank you for today. During this presentation, we as new graduate nurses will learn and understand the importance of nurse-to-patient ratios and the effect it has on patient health outcomes, safety, and incidence of medication errors. Together we will assess data relating to patient health outcomes, satisfaction, acuity of care, and how this can be influenced positively or negatively with staffing/nursing ratios. To attain a healthy workspace where the nursing team work together with a common goal, this goal being to achieve optimum patient results and combining knowledge to maintain adequate care and completion of tasks, there needs to be effective and consistent leadership.